Gaido. For those of us who are unable to afford expensive consultants, we live in a country where I think consultation fee for a typical psychiatrist, I don't know, 3,500 to even 4,500. For those who cannot afford such expensive consultants, what interventions are available? Given that Mathari Mental Hospital might not look like a very appealing option. I mean, when you disappear for a couple of months and you tell your colleagues that you're in Mathari, I don't think that would, augur very well with many people. So what options are there?
Okay, so firstly, I'm going to, for the rest of my professional life, I'm going to be devoting it to changing what we think about Mathari Hospital. I'm hoping that when I'm done, everybody will be clamoring for an opportunity to be seen at Mathari Hospital, because that is something we need to work on. It shouldn't be that if I say I spent a week at Mathari Hospital, people start getting scared of me. It should be that if I say I spent some time at Mathari Hospital, people will be very happy that I am now well enough to interact and to do the things that I need to do. I agree that the services have been expensive. These mental health consultations are very expensive, and the reason is that there are few specialists in the field. What we are doing now is that, in fact, we have trained people whom you can talk about as primary mental health care providers. We have trained medical psychologists. We have trained some clinical psychologists. We have trained, cadres of people who can provide some of these services when you need them, without necessarily getting to a point where you need to see a psychiatrist, for instance. And the majority of people will need those services when symptoms are still early, and it will prevent, if you see these people, then it prevents the need for you to see a psychiatrist, where you might have to pay a lot of money. So those are some of the moves, and I've seen government is employing these psychologists and other middle cadre mental health workers. So let's take advantage of that. Let's use them, and they're not as expensive as seeing a high-level clinical psychologist or a psychiatrist. Having said that, I think there are ways in which you will find psychiatrists who charge all sorts of you can get a psychiatrist for 2,000 bob. If you went to KNH, there is a psychiatrist. I don't think you'd pay as much as if you went to see a private psychiatrist. Some of our county hospitals also have psychiatrists, and you could see them there, and it will not cost as much as if you went to a private one. Moi Teaching and Referral Hospital in Eldoret, these big hospitals, you'll find that they have at least 1 or 2 psychiatrists where you can get the same service, the same quality of service, but at lower costs. For the private ones, as the way the system is set up is that we leave the pricing to the market, and people vote with their feet. Unfortunately, those that everybody wants to see, they will charge more, and so that's just the nature of the beast.